This presentation is adapted from Pulmonary, Sleep, Cardiology, and Critical Care Academy, an online CME-accredited course for advanced practitioners and physicians. The standard paper speed for EKGs and rhythm strips is 25 millimeters per second. On occasion, there may be a reason to slow down or speed up the paper speed. One should be aware that the rhythm will appear much slower with a fast paper speed and vice versa. Therefore, with standard paper speed, every 25 millimeters represents 1 second. This translates to every 5 millimeters representing 0.2 seconds or 200 milliseconds, and every 1 millimeter representing 0.04 seconds or 40 milliseconds. Likewise, the y-axis represents voltage. In standard settings, 1 millivolt is represented by 10 millimeters. This means that every millimeter represents 0.1 millivolts. The normal cardiac cycle begins with the P wave, which represents electrical activity. This is followed by the QRS complex, which represents ventricular depolarization, and finally, the T wave represents ventricular repolarization. The PR interval is measured from the beginning of the P wave to the beginning of the QRS and is normally 120 to 200 milliseconds. The QRS interval measures the width of the QRS complex and ranges normally between 80 and 100 milliseconds. The QT interval is measured from the beginning of the QRS and the end of the T wave and predominantly reflects repolarization time, although it does include the QRS duration. The QT interval is affected by the rate. That is, in a healthy patient with a slower heart rate, the QT interval is expected to be longer and vice versa. To be able to compare QT intervals between patients or even within one patient at different heart rates, we need to do a correction to account for the rate. The correction is called QTC, or corrected QT interval. We get that by dividing the QT interval that was measured by the square root of the interval time. A normal corrected QT in males is between 350 and 450 milliseconds, and in females, 360 and 460 milliseconds. To give an example, if a patient has a rate of 30, then we know that the interval time is 2 seconds. The QT, if it was 545, it would seem long, 545 milliseconds. But when we divide by the square root of the interval time, which is square root of 2, we get the corrected QT more reasonable at 385 milliseconds. So let's turn our attention to the QRS complex, starting with the Q wave. The Q wave represents septal depolarization and is seen as an early, brief, small downward deflection in most leads. To understand why this is the case, it's important to understand that the septum depolarizes normally off of the left electrical bundle, so the direction of depolarization is left to right. Therefore, septal depolarization is away from V6, thus there is a negative or downward deflection in this lead. On the other hand, septal depolarization is towards lead V1. This leads to an upward electrical deflection in V1. Some would call this a septal R wave in V1. Now let's take another look at the R wave to show why it's displayed in V6 as a positive wave. The R wave represents the main part of ventricular depolarization and is normally seen by a large upward deflection in most leads. This is because the ventricle normally depolarizes from right to left. Thus, ventricular depolarization is towards V6, and there is a strong positive electrical depolarization activity in V6. On the other hand, ventricular depolarization is away from lead V1, leading to a strong downward electrical deflection in V1. The next step in EKG interpretation is determining the rate. There are two methods we can use to determine the rate: the 3-second marker method, which can be used with any rhythm, or the counting method, which should only be used with regular rhythms. Let's start with a discussion of the 3-second method. You will note that most EKGs and rhythm strips have markers indicating 3-second intervals. That means that 2 consecutive intervals represent 6 seconds, as is shown here. So, if we count the number of complexes in a 6-second interval, in this case, we count 11, then we can multiply the number of intervals in 6 seconds by 10 to determine the heart rate, which would be the number of intervals in 60 seconds or a minute. So 110 would be the rate for this patient who had 11 heartbeats within 6 seconds. Now there's another method called the counting box method, or at least that's what I call it. Only use this for regular rhythms or else you can get a very inaccurate answer. So to remind ourselves as to how this method, or to show how this works, let's remind ourselves that a standard EKG runs at 25 millimeters per second, so that each little box is 1/25th of a second, that's 40 milliseconds, and each big box is 200 milliseconds, or 1/5 of a second. That's a big box, 5 little boxes. So there's 5 of those big boxes to a second. So if you look at this diagram, if we assume the paper speed is 25 millimeters a second, then if you look at this pink, if there was a tachycardia, and these complexes were every large box or every 5 little boxes, that would mean that there is 1 heartbeat every 1/5 of a second. So we would have a rate of 300, 5 times as much. Now, if it was every other box, we wouldn't really have to think about it much. We would just say, oh, it's half of the original rate. So it's 150. And if it's every third box, it's 100, and every fourth box, 75. So what we're doing is we're starting with the fast rate, which would be 300 if it was 1 complex every large box. And we're just seeing how many times slower is it, 2, 3, 4, or 5 times. And we get a really nice mnemonic, which you can just memorize. It's 300, 150, 175, 60, 50, and 42. So, and I'll show you how to do that memorization. You can analogously do very fast rhythms that are even faster than 300, or in the 200s and 300s, using the 1500 rule. Instead of dividing the number of big boxes into 300, you do the same thing, but you divide the number of small, the one little tiny boxes, into 1500. If you'd like to learn more, please visit our educational center at pulmonaryandsleepacademy.com, where we have 70 hours of self-paced online CME-accredited courses covering pulmonary, sleep, cardiology, and critical care medicine. Please enjoy more of our short visits on our PSA YouTube channel. You can purchase our full courses with an exclusive 10% discount code using YouTube10.